Welcome back to Primetime News and a special welcome once again to our viewers on onespotmedia.com. Up first this evening, the country reached another record high in COVID-19 infections. More than 400 people tested positive on Monday, bringing the total number of cases to 19,773. Now, later in this newscast, the Health Minister, Dr. Christopher Tufton, weighed in on whether there should be a nationwide lockdown. But first, we have the reactions from the private sector and the manufacturing sector. The spike in COVID cases is causing worry among workers in the public and private sector, with the president of the Jamaica Confederation of Trade Unions, Helene Davis-White, saying that those who have to take public transportation are particularly on edge. Now, as you'll hear in this report from Vashon Brown, the manufacturing sector is also being hit hard.
COVID-19 cases continue to increase in Jamaica. It's why President of the Jamaica Confederation of Trade Unions, Helene Davis-White, says workers in the public and the private sectors are concerned.
Particularly for those workers who have to use public transportation to get to and from work, they are extremely concerned about how exposed they are, how vulnerable they are to the virus while they are traveling to and from work.
President of the Jamaica Manufacturers and Exporters Association, Richard Pandowi, says he understands the transportation concerns.
We're also spending significantly on transporting workers to avoid public transportation, separating shifts, investing in protective equipment. We will overcome this, and I expect some level of normalization by September of this year.
Mrs. Davis-White argues that the new protocols that do not require workplaces to close after a positive case is also causing worry. In the early stages of the pandemic, when a positive case was identified, the workplace would have been closed for deep cleaning before employees re-enter to work.
The protocol from the Ministry of Health is that you clean the immediate workspace of the person who has been found to be positive, and you try to do some kind of contact tracing with the individuals who work in close proximity to that individual or who work in a close working relationship with that individual. I think persons were more comfortable with the entire workplace being closed and being deep cleaned. They felt more comfortable with that than what is happening now.
Mr. Pandowi argues that workplaces have implemented strict COVID-19 protocols. The problem is many workers are getting the virus in their communities. The end result, productivity is impacted.
On average, each person that is positive impacts 3 other workers. This year has been very challenging so far, with several companies reporting unavailability of staff, which has caused some reduction in production and definitely a negative impact on productivity. But thankfully, none of the cases have been severe enough that any operation has been closed, not one.
So what should be done to control the spread of the virus?
For me personally, I would have preferred us biting the bullet and do a shutdown for 2 weeks or so, similar to what is happening in Barbados now. And you know that you're going to take a hit in the economy. But because the vaccine is supposed to be coming in a very short while, because I'm understanding it may be here earlier than April. If in fact we do go that route, I think we'll be able to hold the numbers down for much more than what is being done now.
In the meantime, Mrs. Davis-White is again calling for the government to implement another work-from-home order. This, she argues, will send a signal to employers to allow those who can work from home to do so. The government first introduced the work-from-home order in March last year, but allowed it to expire. Vashon Brown, TVJ News.